Hi, welcome to Healthy Living. My name is Amy Bouton with St. Tammany Health System, and today's Healthy Living, we're focusing on back to school since we're right around the corner from back to school. And we have 3 guests that are going to join us today to talk about some important things for parents and children to know when their kids do return to school and before they return to school. So my first guest is Dr. Russell Reed. Dr. Reed is an interventional cardiologist who practices at our St. Tammany Health System Cardiovascular Clinic. We have 2 locations, which we'll talk about later in the segment, but thanks so much for joining me today, Dr. Reed.
Well, thank you for having me.
Yeah, it's great to have you here. Can you tell folks a little bit about yourself, about what you do, and a little bit about your care philosophy?
Okay. Well, I was born and raised in Mississippi and actually practiced on the Gulf Coast for 4 years before moving here, and I'm going into my 5th year here now.
Oh, good.
But I'm trained in interventional cardiology, so I mostly do balloons and stents and those type of procedures, but practice general cardiology as well. And as far as just philosophically what I do and what I've always tried to do is treat every patient like they're a family member. Every person I see, I treat them like they're my parents, treat them like they're my children, and so that's why going back to school and what we're about to talk about as far as sports screening is important, because I have 3 children, 2 of which are teenagers, so it hits close to home there.
Yeah. So, and I'm glad that you talked about what we're going to talk about, because we know that children, when they go back to school, there's a lot of adolescent athletics that children can join, boys and girls, and they do sports physicals. Most are required to get a sports physical, but to get a little further into protecting their health, we do offer something through our outpatient pavilion at St. Tammany Health System, and you read the results of those things. It's called the Living for Burke screening, and this was brought on because we got into a partnership with a local family who started a foundation called Living for Burke when their teenage nephew died of sudden cardiac arrest after football practice during a pickup basketball game many years ago. And so they started a foundation, and the Living for Burke screening involves an EKG and an echocardiogram. And so the young man, it was determined, died of sudden cardiac arrest, and so therefore this is what came out of it. So let's talk about that, about how this helps to determine the heart health. What is the importance of the EKG and the echo?
Well, it's really a good screening because, and a lot of, going back just a little bit before the testing, it really starts with just talking. And the American Heart Association has a 14-point assessment where it's really delving into symptoms, history, personal history, family history that could signal that there could be an underlying cardiac issue. So where the EKG comes in is it just gives you a baseline tracing of, can give you an idea of any structural heart problems and also any arrhythmias, because those are 2 things that we really worry about or can be causes of sudden cardiac death in anyone, but especially young youth and children.
Right.
From the EKG, then the next step will be an echocardiogram, and that's where we can actually look at the heart, we look how it beats, we look at the valves, and so that gives us an idea if there are any structural abnormalities.
Right.
Anything that we need to do, any further testing from there.
So parents, why would you recommend this for parents, or why would a parent opt to do this, especially if their child is a student athlete?
Well, every student athlete starting from age 12 needs to have some type of screening. Now, not everyone has to have, an EKG and echocardiogram.
Right.
But certainly red flags, whether it's symptoms, but most importantly, if there's any sort of family history. If you have a family member, whether it's a parent, whether it's a cousin, someone who suffered some sort of adverse cardiac event, sudden cardiac death, where you want to make sure that there's no genetic problem that you could have that too. Those are the ones that I would certainly recommend have screening.
And once, like you went over this a little bit, but once the screening is done, there are factors when you read those test results that can give you an idea of maybe something is going on, or we could look into it further, or if there is some sort of abnormality that needs to be looked into deeply.
Right, correct. Because, especially with the echocardiogram, one of the things that we worry about, and one of the factors that we've seen in sudden cardiac death in athletes is hypertrophic cardiomyopathy, which is you have signals on EKG that can suggest that, but the echocardiogram you can really see it. So that way you can start testing there, and you don't push that child into athletics and put them at risk.
So aside from, like you said, family history, or someone had an event or something like that, what is something that parents should look for as far as, are there signs and symptoms of something that would lead up to a cardiac event?
Well, probably the main ones you worry about are if your child starts experiencing some shortness of breath, and not the shortness of breath because they're out there in the heat and they're tired, but something that's out of the ordinary. If they start having any sort of chest pain, or if they, and probably one of the biggest concerns is if they start passing out.
Okay, so that's good to know. So if something is discovered during the screening, what happens next? What's the next steps?
So if something is abnormal on the screening, then the next step is really for them to probably do further testing, whether it's we have all kinds of newer cardiac testing, whether it's MRI, but probably get in to see a pediatric cardiologist to really look into exactly what's going on. And sometimes it involves more genetic testing, and we have different subspecialties of cardiology that they may need to go and see some of those physicians to make sure that we know what we're dealing with, and also it gets adequately treated.
Okay, that's good to know. So let's talk about the fact that it is hot outside. How does the heat factor into heart health for children and adults? Because they have these practices during the week, or during the summer, and it's really hot outside, and a lot of these kids are wearing a lot of equipment. How does the heat affect the heart health, and how do we keep our hearts healthy when we're under this kind of stress?
Yeah, this heat, you said the word, it's stress. When it's this hot, every time you go outside is a stress test. So when you're practicing in the heat, it's hard on your body, and that's where everyone, the athlete, the parent, the coach, everyone needs to be cognizant of what these kids are going through. So it's important. Staying hydrated is probably the #1 thing.
Okay.
The kids don't need to be a hero. If it's too hot, you need to take breaks. Make sure, and then normal things that everybody needs to do. Make sure they're properly fueled, eating right, getting plenty of sleep, and rested for those, for those hot days.
Okay. Well, thank you so much, Dr. Reed. If you would like a Living for Burke screening for your child, you need to contact our Paul D. Cordes Outpatient Pavilion and ask for the Living for Burke screening. This is an out-of-pocket expense for parents. It's $150. It is not billed to insurance, so you can self-refer. And we'll have that information for you on the screen for you to reach the Outpatient Pavilion. So we want to thank Dr. Reed for being here, and we want you to stay with us because we're going to talk to Dr. Linda Kiefer next. She's a pediatrician with St. Tammany Pediatrics. We'll be right back.
The North Shore has always marched to the beat of its own drum, and the cardiology team at St. Tammany Health System has always stayed in rhythm with the community we love so much. Here, many talented specialists and subspecialists devote themselves to providing minimally invasive cardiac surgery and the latest advancements in cardiac disease prevention. Together with our partner Ochsner Health, we're making St. Tammany hearts beat stronger.
Welcome back to Healthy Living. As we talked about in the first segment, we were talking about back to school, and we're talking about things parents can do for their children and also for themselves to get ready for back to school. So now joining me, we have Dr. Linda Kiefer, and she is with St. Tammany Pediatrics. So thank you so much, Dr. Kiefer, for joining us.
Well, you're welcome, and thank you for having me. It's my pleasure. Yeah.
Well, we know that when kids are getting ready to go back to school, parents are focused on making sure that they have all the right school supplies and all the things they need, but there are other important things that parents need to be made aware of and reminded of, and I'm one of those parents, as we talked about earlier. You need a few things: childhood immunization. Sometimes you might need a sports physical. You might need a wellness visit. All these things are important to do before school starts. But before we get into that, let's talk about you. Let's get to know you a little bit for people who might not know you. What do you do for St. Tammany Pediatrics, and tell us a little bit about your care philosophy.
Okay. Well, actually originally I got my bachelor's from Loyola University in New Orleans, and then I have a PhD in biochemistry. And I did scientific research for a while, and I was on the faculty at LSU Medical Center for 6 years or so when I decided I really wanted to go to medical school. So then I went to medical school at LSU, and I went into their internal medicine and pediatrics combined program and practiced as both internist and also as a pediatrician.
Oh, good.
And came to the North Shore in 1997, and I've been part of the St. Tammany Network since 1999. And about 5 years ago or so, I really missed having more kids. I really wanted to get more kids in my practice. So I've been focusing on just pediatrics since that time.
So I'm sure you know a lot of families here on the North Shore.
I do, and I love that. And you know, part of what we try to do as pediatricians is to help guide families in raising and caring for the children and educating everyone about what is the healthiest way to approach your life and the care for your child. And we try, we work with individuals because everyone's different,
right?
But we really try to just kind of help coach them a little bit along the way.
Well, that's great to know. It's a nice, well-rounded system of care, it sounds like. So that's good.
Yeah.
So let's talk about back to school and immunizations. A lot of times children will go back to school and they need certain immunizations at certain ages, and I'm not sure if parents know if that is a separate appointment. Do you have to schedule like a wellness visit for that, or can you just schedule immunizations? How does that work? What would you advise for parents?
Well, most of the time, one of the things that we do at the well visit, which we encourage everybody having every year if they're due vaccines or not, is that's the time when most often we will give immunizations, and it gets updated constantly because there are new recommendations for what's good to have or when to have it,
right,
in terms of shots and things. This year, example, the state has passed a law previously that is now the hepatitis A vaccine is one of the required by the state.
So that's new.
Vaccinations. Yeah, it's new, but it's been phasing in since January. So it's one of those things. Most kids have 2 doses already, but because of the way that it first came out and was administered to just younger kids initially, and then recommend later for the older kids, there are some kids in that middle to teenage range that may not have had them, or some states still there are children who haven't been getting the hepatitis A.
Right.
So that's something that they do need to get, and they're supposed to have 2 doses by the time they start school this fall.
Okay.
If someone has already had a well child visit that year with our clinic, and then it turns out there's a new requirement like that, for example, and they need to have a vaccine, then in our practice at least, certainly we can give them that vaccine as a nurse visit.
Oh, good.
But if they haven't been seen in a period of time, then we would like to see them first.
Right.
Which is one of the reasons why keeping up with the well child visits helps to maintain that kind of ease.
Sure. And what should parents should probably avoid certain conditions where they wouldn't want their child to get a vaccine, like if you have a flu virus, or if you have fever or something like that. What are some things that they should avoid?
It's usually fever, if they're having fever or they look like they're about to have fever because they've been sick. Now, if they have a cold that they're recovering from and they're doing fine, or they just have their allergies and they're doing fine, those are not reasons not to get a vaccine.
Okay, gotcha. And let's talk about once they get the vaccine. Like should you not do it right before school starts, like the day before, for some kind of, in case they have a reaction to it, or are there any parameters around that necessarily?
It kind of depends. Vaccines that are what we call live vaccines, like the MMR and the chickenpox vaccine, the varicella vaccine, those are a little bit more likely to possibly cause fever and achiness for a day or 2 afterwards. So those, it might be a good idea to give them a couple of days in advance at least. Many of the other ones usually don't provoke that kind of response.
Okay. So let's discuss the well visits, because you were talking about the importance of well visits. Why are they so important? Go a little bit more deeper into why, because I don't know that every parent understands the reason why they're so important.
Right. Well, at the well visits, we usually take an extensive set of vital signs like blood pressure and pulse, and height and weight, and we plot them on the standard curves that we have so we can discuss with the child and with the parents how they're doing in terms of their growth and development.
Right.
We assess a number of different things that the families may not have been aware of. We go over their diet, what types of foods, and the latest trends for what's healthy to do, and whether or not someone's being prone to constipation, which is a big problem that many times doesn't go noticed because after a certain age, parents aren't really seeing what their kids are doing, but it can play a role into their function.
Sure, into their health.
Yes, and we go over how they're doing in school, the reading, and if there's any other kinds of issues that oftentimes the parents may not have actually been aware of.
So it's not just physical health. You can kind of get a mental picture and an academic picture and cognitive function and all that. Okay, well, that's good to know. So let's quickly touch on sports physicals, which we talked about a little bit with Dr. Reed, but sports physicals, if parents need a sports physical, is that something you can provide?
Oh yes, definitely. And like I said, we oftentimes when we do the well visit, we often cover a lot of the same things that would be needed for a sports physical.
Okay.
And so a lot of times that will substitute for that.
Okay, perfect.
So sometimes it's more convenient to come in earlier during the year for the well visit.
So I think they count for a year usually.
Yes, they usually count for a year.
Okay, good.
As long as there hasn't been an injury or
Since
something
the well visit.
since the well visit. Yeah.
Okay, and real quick, because our segment is almost over, but I was very much a stickler for my children washing their hands right when they got home from school and taking their uniforms off because of things they might have been exposed to at school. Are those some good tips on how to keep yourself healthy, and what other things would you advise for parents to teach their children when they're in school?
Definitely washing their hands frequently, trying not to touch their mouth, put their hands in their mouth or their eyes. Rubbing your eyes also is a good way to get an infection, it's through hands to the eyes.
Okay.
But other things too is getting plenty of sleep in general, because many children, especially when they get busy in school and sports, they're not getting enough sleep, and they really should be trying to get at least 8 hours of sleep a night.
Okay.
And one last thing about that, a lot of the kids are completely off their sleep-wake cycle for the summer. This is definitely the time to start getting them weaned towards waking up early enough to go to
Back
school.
on that schedule.
Yeah, it takes almost 2 weeks to get them well acclimated again.
Okay.
So it's a good thing to do.
Okay, we want to thank Dr. Kiefer for joining us, but stay tuned because our next guest is Bethany Monasterio. She's a registered nurse, and she's also the manager of our trauma services for St. Tammany Health System. We'll be right back.
Kids should be seen and heard.
At St. Tammany Health System,
Many kids are being treated like, well, kids. We're not little adults, you know.
they have the North Shore's first kids-only ER.
And ICU. They even have a parenting center.
Kids aren't the only ones who need to go to school.
Together with their partner, Oxnard Health, St. Tammany Health System makes it easy to be on our side. On this side of the lake.
Welcome back to Healthy Living. Our guest, Bethany Monasterio, she is a registered nurse, and she's also a manager of our trauma services. So thank you so much for being with us, Bethany, today.
Thank you.
Tell people a little bit about what you do at St. Tammany Health System.
So at St. Tammany Health System, I wear a couple of hats. So I am the manager of our trauma services, which includes injury prevention, community outreach, making sure that we meet the standards for the American College of Surgeons to be a certified, verified trauma center. And we work with the state and the region on all of those things: community outreach, injury prevention, and becoming a trauma center to be able to take care of those traumatic injuries that happen.
Okay.
Not always bad traumatic injuries, but a broken bone is trauma. So a lot of people don't understand that something that seems minor is trauma if it's not a medical issue. It's most of the time trauma.
And we should let folks know you just completed the recertification.
We did,
very
yes.
successfully with flying colors.
we
So
did.
congratulations
Thank
for that.
you.
So we're talking in kind of in the vein of back to school.
Yes.
Lots more kids playing sports, vehicles on the road, teenage drivers. There's a lot of things that ramp up as soon as the school year starts. So you teach a course called Stop the Bleed.
Yes.
And this class is open to the public. As a health system, can you tell us why we brought Stop the Bleed in? Why do we teach the class?
So as a trauma center, you really want to focus your top 3 mechanisms of injury, so the reasons for injury, and do community outreach and injury prevention on those 3. We are always there, but we don't want more patients. We don't want anyone to get injured. So our number 1 reason for injuries is falls with our geriatric population, but then very close to that is mechanical injuries that cause life-threatening bleeding, which is very dangerous because it's the number 1 cause of a preventable death from 0 to 45 is trauma. And then bleeding is one of the highest things that can happen to cause death, which there's so many small things that we can do to prevent hemorrhage. And Stop the Bleed was made by the Hartford Consensus with the American College of Surgeons, the Committee on Trauma, our military, lots of coordination to bring this program to the public for anyone.
So you said mechanical injury. What's an example of a mechanical injury?
So being in a rural setting, we get a lot of injuries with farm animals, house animals too. A lot of it sounds really bad, but when you accidentally close your hand in a door or any of those, it's any kind of force, a blunt force, and it can be a penetrating injury. We see a lot of construction injuries and things of that nature, but with school ramping up, bicycle and car accidents happen a lot. But sports injuries happen, and those are very common, especially with the sports ramping back up because of school. Lots of the distracted driving with car injuries, accidents that do happen. We don't call them accidents, we call them collisions because we want those to not happen, but there's so many things. Kitchen accidents happen. Those I will call accidents because
it's usually not on purpose, and you're not usually distracted. It's just something goes wrong.
Exactly. There's plenty of things that can cause bleeding, and we want people to understand it's a very simple, common thing that can happen, and we want people to understand what to do if it becomes a life-threatening bleed.
So give us some examples of what you would learn in the course.
So very simple. There are 3 main things that we teach about. Pressure, which is what most people will do, even if you get a paper cut, you squeeze your finger. Pressure, packing, and then tourniquets. Those are the 3 skills that we go over. We have an in-depth class that we teach, and there's also an online version, and then you can come in and do a skills version where we get to put your hands on all of the materials and the goodies that we have.
So show us some of your goodies.
So this is a Stop the Bleed kit, as well as this one. They look a little different. And one's vacuum sealed, and then one is just a fancy zip pouch. But most of your Stop the Bleed kits come with a cat tourniquet, some bleeding control gauze that it has a little stretch to it, and some Velcro so you can do a compression bandage, some regular gauze, gloves, because we do want to maintain our safety when we're touching other people's bodily fluids. A survival blanket. I know it's 100 degrees outside, but when people bleed, if they bleed a lot, they get really cold. And when you're cold, your blood doesn't clump together like it's supposed to. So if you are bleeding a lot, we need to make sure that we can maintain your normal body temperature. So we have that. And they come with Sharpies, and what I always like to tell people is it's okay if you come to our class and you forget everything that we teach you, because every single kit comes with instructions. And this is my personal kit, so it does, I show a lot of people, it may be falling apart, but it's totally fine because I can still open it and know what to do. And they come with a pair of trauma shears. So most kits are built the same, but it's very important to understand when you do have to use a tourniquet. Not everybody's put their hands on a tourniquet before. And that's what we like to do with the public is we let everyone touch the tourniquets and practice putting it on themselves, because you can put a tourniquet on yourself as well as help someone else. And it's really important to see the different types of tourniquets and be able to put your hands on it and know how it works. Because,
and when you need to use it.
And when you, yes, definitely. I never touched one. I've been a nurse for quite some time, and as a nurse, we don't need this when we're in the hospital, because we have so many other things that we can use. So I didn't know how to use it, and I started playing with one. And when I took my first class in 2018, I started learning how to put them on, and now I can probably put one on with my eyes closed. But I think it's very important to have that hands-on skill for anyone. Yeah,
to learn what you need and when you need to use it. So how old do you have to be to take the class?
So I have taught as young as 8 years old.
Okay.
If parents feel that their child is old enough to understand what all of the stuff entails, and they're okay with hearing some nasty, gruesome stuff. Not every child is okay with that. I know mine is. She's taken the class, but she was 16 when she took it.
Right.
And that's fine. But you know, we've taught out in the schools before, and I had an 8-year-old. He was very, very enthusiastic about the class. And the second his mom walked in, he said, "Mom, we need to get a kit.
Yes.
We need to get a kit." So. It's if you know your children. Mm-hmm. So if you feel like your child is able to sit through a class and absorb this information, let them take it. I'm open to teaching anyone. We've had some younger students that, you know, they know what this stuff is, and they teach the basic safety stuff at our parenting center. So they have a couple of classes at the parenting center for the younger age.
Sure.
But for this, if you feel like your child can actually handle doing something like this, then there is no age limit.
Okay, and we offer these classes free at St. Tammany Health System. You can go to our website. I'm thinking Boy Scouts. What a great thing for Boy Scouts to learn. If you have kids that like to do camping, if you have kids that do sports, parents, and you know, it's a good thing for them too. Is there anything else you'd like to add before we wrap up? Yeah, so our legislation actually passed the School Safety Act this session, and it's Act 334, and this is basically saying that elementary and secondary education is now going to be required to have some sort of kit in the school. Oh, good.
Whether it's a kit like this or they can make a kit. The State Board of Elementary and Secondary Education are developing the actual rules behind it, but now they're going to say that we need to have these kits in our schools, which it is very important to have these kits. If you have a resource officer in your school, they have tourniquets already, and they are very well trained on how to use them. We never want to have to use these in our schools, but I think it's better to be prepared for something like this than to not be prepared. Sure. Well, thank you so much, Bethany. You're welcome. Excellent information. We are looking forward to sharing it. And thank you for joining us for this episode of Healthy Living. We'll see you next time.